I'm Gene.
And I'm Dave.
And we're the
Gene and Dave Show. Hey, thanks for watching the Gene and Dave Show. We've got a special episode for you today. We got a call from Marge Petty's team. Who's Marge Petty?
Marge Petty is the Region 6 Director of the Department of Health and Human Services, which covers Texas, New Mexico, Louisiana, Oklahoma, and I forget where else. But it's quite a big area.
Yeah, and somebody from her office actually called us, wanted to get some time with the Gene and Dave Show, and wanted to explain to us about the Affordable Care Act and the things that are going on in this area, this region, and she wanted to use our show to talk to us so that we could reach back to you, our lovely viewers. We thank you so much for watching.
Thank you.
About details and things about the Affordable Care Act and how it's going to help us, all of us as a nation.
Yeah, they really wanted to talk about the pre-existing condition insurance program, but they've got so many programs. They gave us all kind of web addresses and phone numbers, which we'll have posted on our webpage. But she was very open to us. She was telling us, if we've got questions, they could send speakers out to talk to groups about the Affordable Care Act. So
yeah, the Affordable Care Act is huge. There's a lot to it, and it's very hard to put a grasp on it, or even just get your mind around it. It took them several years just to write and to get it in, but she explains it pretty well from a high level here in this interview, and I hope that you'll get something out of it.
Hey folks, we're here today with Health and Human Services Regional Director Marge Petty, who is responsible for guiding and coordinating Health and Human Services policies in the states of Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. With us, of course, my co-host Dave and Mr. Dennis Burrell with the Coalition of Texans with Disabilities. Ms. Petty, do you mind if I call you Marge? We're here in Texas. Yes. We like to get familiar with folks.
That's okay. May I call you Gene?
No, Mr. Rogers. Should call you Gene. It's a real honor.
For me too.
Well, that's what I meant. We're here today so you can explain to us the Affordable Care Act. What, in a nutshell, is it, and why should people with disabilities care?
Well, ACA, it's difficult to put ACA in a nutshell because it is so expansive in terms of the impact that it can have on people throughout the country, all people. I think it's been noted for a long time that there have been a number of people, 42 million uninsured folks across the country, escalating healthcare costs, small businesses, the cost of covering employees in small businesses escalated 85% since 2000. So all those factors have converged to provide the impetus for this new legislation that was passed in March of 2010. The important pieces of this affect people all across the country, all ages, and it makes basically healthcare more affordable and more accessible for people all over the country. The date, 2040, is the target date because by 2014, insurance should be available to all folks without any kind of ability for people to discriminate or turn down people for insurance options. One of the key pieces of the ACA legislation that went into place is called the Pre-Existing Condition Insurance Plan. And one of the reasons it's so important to Texans is probably there are more uninsured people in Texas that might be eligible for this particular program. Then I think they're about the second in the country in the terms of numbers of people who are eligible. What people, I think, know is that oftentimes insurance companies have turned down people with asthma, or that they may have discovered that there was cancer, and then they've terminated their insurance coverage. And so this is possible coverage for people that haven't had access before.
I know a lot of us folks with disabilities, say maybe go through college or some training program, short guys like you and Dave will get snapped up by big companies, but then we lose whatever, say Medicaid or Medicare we have, and then we're looking at paying insurance that the big companies are having no insurance at all if they exclude us because of pre-existing conditions. But with this Affordable Care Act, we won't need to worry about that, will we?
Well, one of the important aspects of the ACA, of the Affordable Care Act, which began in July of last year, is this pre-existing condition insurance plan. And the criterion, actually, there's 3 criteria. You have to be a U.S. citizen in good standing. You have to have been without insurance at least for 6 months. And you have to have a pre-existing condition that has precluded you from getting insurance. So, and one of the great things about the way Texas has operated is that it is in fact possible for people to go through a broker to get documented that they have some pre-existing condition that has precluded them from having insurance. Also, within the last couple of months, actually more recently than that, probably about the last month, they made it possible for if you had a physician or a physician's assistant or a nurse practitioner that verified, in fact, there was a pre-existing condition or something that would preclude you from getting insurance, that you could be covered then and be eligible under that 3rd criterion.
Yeah, this is scary to be without insurance. I mean,
Terribly
a trip
scary.
to the emergency room could run tens of thousands of dollars.
Terribly scary. You know, one of the great things about this insurance plan too is that more recently they have scaled down the premium costs so they've become more affordable, and they are tiered in terms of the age, like 0 to 18 is, let's see, I can tell you exactly what is 0 to 18.
Just off the top of your head, what would you say it is?
It's $133, 0 to 18. And somebody from 19 to 24, now that's under the standard option.
And that's very reasonable.
It's very reasonable. Now, one of the great things about this program and what Texas opted to do, Texas has been extremely supportive, and they opted to have the federal government basically administer their plan. What happens is people with pre-existing conditions that are put into a pool of people that do not have any pre-existing condition, which lowers the cost and the premiums for everyone.
Is this unfair to the folks that don't have pre-existing conditions?
Well, of course, my feeling is no. What it makes possible is insurance available to everyone, and people that have not had the opportunity to be covered. I mean, you know, we talk about fairness. Is it fair for people to have been precluded at some point in time for having coverage when they needed it?
May I ask you a question, a follow-up to Jane's question, Marge? Texas has, I believe, the highest percentage of uninsured people in the entire nation, and certainly of children, uninsured children. Do such states with a high percentage of uninsured people stand to benefit more greatly than states that have less uninsured people?
Well,
Are we a high benefit state for the ACA is what I'm asking.
well, it depends on how you're defining benefit. The reality of it is when you've got a higher population that are uninsured, and for a program like this where there was specific money set aside for claims that would occur for people who are eligible and sign up, that money has already been set aside. They're second only to California in terms of resources that are available for those claims. So we all have a real investment. I mean, I'm a Texan. I have an investment in making sure all those people who are eligible and need to know about this, because there are resources available to support them in getting the health care they need that right now is not being accessed. So it's critical, programs like yours and Dave's, to get their word out so that people can access what's available to them.
So what is the easiest way for people to access
Well,
that information and figure out, where do I go? How do I start? You know, I don't have insurance right now. What do I do?
okay, well, there's a couple of things. The first and probably the easiest is to go to PCIP.gov if they've got access to a computer. And what will come up is a national map. You click on Texas, if you're from Texas, and what you'll see is a link that can take you directly to a form that will be filled out. 3 of the questions, of course, they would need to ask themselves: are they eligible because they're a U.S. citizen? Do they have a pre-existing condition? And have they been without insurance for 6 months? Those are the 3 keys. But there's a form that they can fill out and have a doctor or a physician's assistant or a nurse practitioner verify, in fact, that they do have a condition that either has precluded them from being insured or would preclude them from being insured. And again, they have to be without insurance for 6 months. So just those documents, being able to fill out that form and have verification that they have a pre-existing condition, then you submit that form online. And I mean, one of the great things is there is not a waiting period. If in fact you are eligible, say you apply on the 14th, by the 1st of the next month, that coverage would be available to you. And
2 weeks is nothing with the federal government. That's amazing with that.
that is the eligibility timeline.
Wow. I understand you're using our show as part of the outreach. What kind of outreach efforts are there in other communities where, say, they don't have the access to the internet or perhaps even TV or something?
That is a great question. We have a CMS team in Dallas that is actually, they have gotten groups of, not only through their staff, but groups through communities that have investment in folks with disabilities, foundations like the Cancer Society, like the Heart Association, where there are people who have chronic conditions. The outreach is directly to those groups. We've talked with the National American Heart Association. We've talked with the Susan Komen group. They have grants throughout the country, 2,500 grants, where there are people that with breast cancer who have accessed those community groups. So the outreach is just not limited, I'll say that. We are reaching out to every foundation, every group, faith-based groups who can get word to their congregations about people that would be eligible. So part of what our interest is enlisting those partners that would be spokespersons for us as well to get the word out. PCIP.gov.
So, and there's a lot more to it as well. I mean, we've got people on insurance now, but there's also been the promises of improving prescription drug coverage for folks that are on Medicare, extending the life of Medicare trust funds by at least 12 years. And other things. Can you talk about some of those others that are going on over these next few years?
Thanks, Dave. Yes. One of the points that Dave raises is the extension of the Medicare Trust Fund. And that is a direct impact from the fraud and abuse work that has been done as a result of the ACA. There are very diligent teams that have gone out, and actually Houston, San Antonio, there are 2 or 3 Waco, there are 2 or 3 communities in Texas who have actually had some real problems, serious problems on fraud and abuse with some of the scooters, some of the inventory that has been fraudulently said, we've got this available, we've got people that want to access this, and then have billed Medicare as a result of that in a fraudulent way. So it's incredible. Just in the last year, in 2010, there's been over $4 billion that's been put back into the Medicare Trust Fund, extending the life of that trust fund again. So that's just one small aspect of the ACA. You know, the funny thing to me, you know, many people have said, oh golly, there's just, you know, it's such a big document. You know, the important thing for people to know is, yes, it is a big document because it is so comprehensive. People have looked at service delivery for healthcare. They've looked at labor and people delivering those services. They've looked at costs.
Was there input from the disability community in planning this?
And they were a part of that. They were a part of the input, particularly on this PCIP program. So of course it's going to be lengthy because it's comprehensive. You know, it's not just, as one might say, a flash in the pan. It's intended to be substantive, long-lasting, and have impact throughout the country.
Marge, Medicaid is of huge importance to a lot of our Texans with disabilities for many reasons, including long-term services and support. There's been so much disinformation, misinformation about the ACA. How will it impact Medicaid?
Well, certainly there is expanded coverage in terms of eligibility on Medicaid. And there has been substantial financial support for states all over the country in expanding that. CHIP is another example of expansion of services to young people who are from families that are a little bit higher than that poverty threshold, but would also be eligible to get medical coverage. So the idea is that by 2014, there won't be categories of people. That by 2014, insurance will be available to everybody, regardless of their level of income, regardless of their disability, regardless of their condition, regardless of their health status. So, you know, it's interesting. Most people don't recognize that as far back as Teddy Roosevelt, there were discussions going on about the need for changes in healthcare.
I'm not surprised at that.
So this is a significant, you know, banner opportunity for the country, the nation, and people that care about others and people in their community to make these kind of resources available.
Now, follow up with another Medicaid question.
Sure.
Advocates, disability advocates in Texas here noted that the legislature passed a bill indicating that the state would pursue a block grant in Medicaid. Now, I understand that the feds have the ultimate say in that, but you know, this whole idea of block granting Medicaid seems to be getting a lot of talk, not only in Texas but other states. What impact would that be? I mean, we perceive it as a way to, if you will, cap available Medicaid funds. Wouldn't that be counterintuitive to the ACA?
Well, Medicaid, of course, is a joint federal and state program, and states have always had the opportunity to set certain thresholds that didn't undercut what the federal government expected. A lot of states are requesting waivers because of the economic conditions across the country. I think that it's one method that states are exploring. You know, I would have personal concerns about who's making some of the determination at a community level. You know, my belief is that most communities and states care about serving their clients and those that are in need. And it's just a tough time now to decide how that money gets spread out. again, that becomes a determination as they're reviewing the waivers on whether block grants are a solution. They're obviously not as prescriptive when it's a block grant. So I think many of us would have a cautionary note about that.
Will Health and Human Services monitor states to ensure that the budget cuts that are implemented are not violating or the Olmstead decision, which I'm sure you're familiar with?
Oh, absolutely. Yes, and of course, that's part of the charge for the federal government is to monitor and audit on a regular basis the resources that are available and how the population is served to be sure that the federal guidelines are being met.
And will it be some sort of 800 number or something where folks can call in to report violations of that?
That's a great question. And I know that there are access points at the state, at the regional level in terms of reporting, and certainly our CMS office that handles Medicare and Medicaid are available. We have resource people and outreach people all the time that are gathering data. And so certainly, but my number, somebody's referred to me as a switchboard operator, so.
So you're open and available, that's fantastic.
Certainly, we are accessible for that kind of communication. We welcome it.
We have a lot of groups and a lot of fans that like our show, that watch our show, and a lot of them are some of the grassroots campaigners here in Texas, and including ADAPT and Genesis, CTD, as well as I also got a message from someone at Advocacy Incorporated here in town, and they're all very excited, but with anticipation and but also just want to make sure that everybody's best interests are taken into account, and they also are looking for more information and where they can find more basic information about this. And is there anything else out there that, I know you have websites that we can go to, videos that we can watch. Is there also ways that they can set up people to come in and possibly speak to their organizations and give more information?
Absolutely, we would welcome that opportunity. You did mention the websites. You may have referred to them before, but healthcare.gov is a great website because you can individualize not only your state, your specific situation, your age. It has an incredible amount of information. Lists of things to discuss with your doctor. But lots of opportunities to individualize. In addition, across the top, if you want to learn more about the law and go through each of those sections, there's that information available as well. But in addition, as you say, the speakers, we have speakers that are available to come out and discuss particularly the PCIP, because that is the major push right now, because it's money that's available to cover people's needs, and we just need to be sure they know how easy it is to check whether they are eligible and access that resource. So we've got people willing to come out and talk in every community across Texas.
That's great. That's very good to know.
You know, Texans are so fortunate because we also have the Consumer Health Assistance Program operating in this state. And that is a section of the Department of Insurance here in Texas. And they are here to help answer PCIP questions or any health insurance related question that folks might have. Until 2014, when things really began to change in the marketplace, certainly there are a lot of questions, lots of things that people are not sure about. So the Texas Consumer Health Assistance Program, TexCHAP, you may also access them online at texashealthoptions.com. They have a telephone number that's toll-free, 1-855-839-4427. And they have been a huge instrumental piece of why we've been able to see some successes and really get out on the forefront of this program. Since April, when the pre-existing insurance plan enrollment number was 1,528, they have jumped enrollment up 300%. We're now at 1,798. Last fall, when this began, we were at 348 enrollees in the state of Texas, and they've been huge, in getting us to the 1,700 number that we're at now. But we know that we're not finished, and there's much more work to be done. So they are on the ground every day, and they're also a huge resource for people to take advantage of.
And for you folks that didn't get those 800 numbers or web addresses, just go to the GeneandDaveShow.com and look for the show on the Affordable Care Act, and we'll have all that information there. It'll all be documented, so it'll be easy to retrieve.
I've heard that for kids with disabilities, there's already been some provisions invoked, right? Can you explain that? As for previously, where they would have been excluded from their parents' employer-provided coverage in some cases.
Right.
How does that work?
Well, there are a couple of things. Actually, children, young people up to 26 can now be included in their family's insurance.
Like today?
Today,
Right.
yeah. That went into effect, that's been in effect since September of last year. But also children that have asthma that have been previously excluded from their parents' coverage can now be included.
As well as other disabilities.
Absolutely.
And in other words, no child whose parent would have been allowed to cover that child had that child been healthy can no longer be excluded for a pre-existing condition.
That's
like
correct.
asthma or cerebral palsy.
That's
or-
correct.
Yeah, that's not, there are many parents in this state that have brought that to my attention and mentioned
That's
how important that was.
That's huge.
In fact, it's almost inconceivable what that means to families because their kids are very important to them and they want them to receive health care, and then to be denied was the situation previously. It was just plain flat out bad public policy. In my opinion, cruel, but I'm glad to see that has changed.
It
Well-
almost practically lives at the legislature when it's in session.
Yeah, I'm sorry, am I starting to lobby you?
Well, we're so grateful, Gene and Dave both, for you allowing us to be on the program to help get the word out, because it's phenomenal, this resource that's available, and we want to be sure that everybody that needs it knows about it and can get the information they need. As Jessica mentioned, the CHAP program at the Texas Department of Insurance, that's a bilingual staff. There are people there that are both knowledgeable and accessible, and so that 855 number is critical for people in Texas to be able to access.
I've got to ask a question. I got to tell you, I'm just still not real clear on health insurance. When it comes to health insurance, I'm as confused as a cow on AstroTurf. And I understand some aspects of health insurance, but in terms of attendance, how do they fit in? Is that something covered by the ACA?
Jessica, can you speak to me?
As of right now, the pre-existing insurance plan has a number of great accessible benefits. Preventive care is covered at 100%, and there are a number of benefit options available for which people can sign up. At this time, Medicare does not pay for custodial care. Medicaid currently does. But the Texas CHAP really is available to answer those nitty-gritty in the weeds questions, and if they're unable to do so, they know where to get the answers. So, to my knowledge at this point, we're looking at preventive care, and then after that, Medicare, we pay for what's reasonable and necessary, and certainly we want to make sure folks have access to what they need. But I think a great place to start for some of those more custodial type questions would be the Texas CHAP program.
And you used the word custodial. I think a a lot of people are afraid you might need institutional.
No, I'm sorry. Custodial care is sort of what we refer to as care that, involves the daily routine tasks, activities of daily living, as we refer to them. And if those are taxing or difficult for someone to take care of, they would need what we call custodial care. Things like bathing and dressing and feeding themselves and taking care of their regular daily life. So that's what we mean by custodial care. We also, on the flip side, have skilled care. And that's when there is a medical necessity behind, a treatment. There's a diagnosis that we're trying to treat there. So that's the difference.
And everybody has different situations. Every story is different, and that's why it's so helpful to have the chat folks where you can actually call and specify your particular situation.
Can we have that number one more time, Jessica?
Absolutely. It's 855 text chat, TEXCHAP, or it's 839-4427. 1-855-839-4427.
Now that's just for Texas.
That is for Texas, and as I said, we're really lucky to have them here. Not every state has this awareness program out on the ground, really trying to share that information with every community. So we're very fortunate they're here to assist with this.
Our show's been accessed by folks in 41 different countries, so I wouldn't be surprised if other states in the country watch our show. How would they find the number to?
They would go to the PCIP.gov website, PCIP.gov. You can select your state and find out which resources are available there. Other states do actually have the Consumer Health Assistance Program in place as well. Not every state does, but again, as Ms. Petty said, it is best to start with PCIP.gov to find out all the information that's available relevant to your geographic location. But in Texas, we're very fortunate to have the Consumer Health Assistance Program.
Very good.
As we talked about earlier, this legislative session here in Texas has been grueling, as it has been all over the United States, but cutbacks, and you can't turn on the news and watch it for more than 5 minutes without seeing something affecting the federal deficit and all the scrutiny that Obama government under the deficit. One of the figures I have from the CBO is that this bill is actually going to decrease the deficit by $143 billion over the first decade, and then $1.2 trillion over the second decade. But there's a lot of folks that are not believing that, and some others that are on the other side of the coin saying that it's going to increase the federal deficit for, well, I've just got one figure here of more than $700 billion in the first 10 years. So, of course, we hope that it decreases it, but can you speak to how it's going to decrease it and why people should really be on board for this?
When the bill was passed, and many of you remember that there was a lot of challenge and time that was spent in working through all the pieces of it. And part of the reason was because for each proposal, there had to be a matched identified funding source. So there's our companion costs. It is not, the point is that it has been funded, just like with the PCIP. There is already money set aside that has funded that. But obviously part of the promotion of it involved what's going to be the impact in the out years. And so part of gathering the support for it was because, in fact, not only would it decrease costs for healthcare overall, but partially because healthcare is such a huge part of our GNP that we could not afford to allow it to continue to escalate as it was doing in terms of the percentages. So again, these are projections in terms of the cost savings, but also the pieces that are in it currently have been funded over time. So there shouldn't be any surprises as long as things are maintained. Things are stay the same.
But
Okay.
There's
the
not-
public is really hearing mixed messages about this. I saw actually a Texas Congressman, John Culberson, interviewed on TV last week, and he was talking about the debt ceiling. He said the way to solve the debt ceiling was to repeal the Affordable Care Act, which of course didn't make any sense to me at all. But I only bring this forth as, you know, citizens out there hear all this stuff, and it's been demigod to death, if you ask me. How do we answer, you know, questions like that people pose to us, like, you know, isn't it true that it's going to bankrupt the country and all this? And I always answer, well, no. As a matter of fact, independent fiscal analysis has showed that it would be a cost saving. Well, how do you?
Well, it's, of course, what you're describing is the political cacophony, you might say. You know, and there's a lot of that dialogue going on. You know, I'm very optimistic that people are asking questions about what's going to contain healthcare costs and what part of it the ACA has in doing that. Let me give you one other example. There's a lot that's been talked about the health information technology and how technology can help us reduce costs. Well, if the banking industry operated as healthcare does now, we'd all be carrying around big sacks of dollars. I mean, banking operates with a very high-tech operation. Information is shared. So one of the things that was done is there were grants given to many states, key grants for health information technology. And there are resources like that in Texas. Out of the Houston area, there's one that I visited in Tulsa where they traced the cost that could be saved by very precise patient and physician interaction on what could be saved, say, in referring someone, how long it took to refer someone. This guy was just amazing. An MPH, MD from Harvard, who'd worked at Tulane, he was at Oklahoma State, and he had documented the savings of over $100 million in transactions in a year's time. Well, you know, that was close to an Oklahoma budget deficit. So obviously, healthcare expenses that are contained or reduced is a different realm than what's allocated legislatively. But all these aspects of finance converge when we're talking about economy and the economic health of a state. So we cannot exclude healthcare costs from a healthy economy and what needs to be corrected in making the economy work better. That's just one example. And, you know, this was a bill that tackles every aspect: healthcare technology, health delivery, labor force, access, health departments. I mean, it's amazing that a legislative body, I think, could create such, quite frankly, a work of genius that has such potential.
Well, healthcare costs are reducing our ability to be competitive in the international markets.
That's
So
exactly.
I hope that we can see improvements in the healthcare costs in the near future. And we certainly appreciate all that you're doing for all of us here in Region 6 and particularly Texas.
Well, I appreciate what you all are doing to get the word out and serve your constituency. I know you've got a large listener group, so I appreciate the opportunity.
And I think they're both listeners.
International, isn't it, Jane?
That's right. International, 41 countries so far, so we're happy with that.
I have one other thing to say, if I might jump in. You know, back to your question and your issue about escalating costs. I think it very well underscores the discussion here today, because we know that untreated medical conditions, as you all have alluded, really affect our productivity and our ability to then go and create economics. And back to the Medicaid question as well, we'll see the system transform through the provisions in this law, and I think preventive care and investing now for what is to come down the road is a critical part of that, and I know that you all have certainly measured that here today with this discussion, but the accessibility that this plan provides is very, very important to that bottom dollar that we're trying to avoid hitting. We're trying to not break the bank, right? So that's what this is really laying the foundation for.
And it has also laid the foundation for incredible partnerships. Another example of those partnerships is the partnerships with hospitals. In 1999, 98,000 people died as a result of a condition or an infection or something that was a result of them having been hospitalized. One of the things that this ACA does is create the partnership with all these hospitals, advocacy groups, patient advocates who have joined in to focus on, okay, what is going on in a specific hospital that could be corrected? And it is so exciting. Seton Hospital is a perfect example of that. They were not satisfied with their birth trauma outcomes. They weren't bad, but they thought they could be improved. So what happened was, voluntarily, the team of providers, the nurses, the physicians, the OT, all the collaborative team, started looking at what was affecting those birth trauma outcomes. It is now at 0.
Really?
In terms of birth trauma. And that affects the amount of Medicaid costs that end up being supportive of problems for a lifetime.
Yeah.
So that in itself is just exciting. We've had over 3,000 people sign up to say, we want to be partners. Another example would be something simple like at the Baptist Hospital in Dallas. We had basically a partnership celebration where there was a physician that came in and talked about a specific incident where nurses would say, well, we're not spreading the infection. We never touch the patient when we go into their room. What they'd done was they were pulling the curtain across as they walked in, and the curtain was examined, and it was filled with bacteria. So what they did was, it became routine to spray it with disinfectant, and the infection rate went down. Same thing in VA hospitals. They did a research project to follow about 153 VA hospitals, and the reduction in infection rate was like 64% reduction in infection rate. So the target in the next 3 years for this partnership for patients is that infection rates would be reduced by 20% in the next 3 years, and readmission rates would be reduced by 40% because
So there's a reduction in cost right there.
Exactly.
That's fantastic.
One more example.
Well, this is like this whole thing with the ACA is like a big onion, and you're peeling back layers and layers and getting more and more information and becoming more enlightened. So I'm looking forward to what we can learn in the future. And gentlemen, do you have any more questions for you guys?
No, this has been most informative, and I'll make sure that our newsletter contains some of those links to those websites and to your website too, and your phone numbers as well, because this is an area that is, as Gene said, there's not many layers of that onion that have been peeled back by most folks. It's still a big mystery to most of them. And this is incredibly important information.
Thank you so much, Marge, and the post-production will edit out David Dennis, so you and I will great.
Wow, Gene, I left that meeting with my head spinning. I mean, there was so much going on. There was just so many more questions that, I wanted to ask, but we just kind of ran out of time.
We really did, but fortunately her office is open to responding to questions. So if you folks have questions, you can either go directly to their webpage or call them, or you can send some messages to us, and we'll try to post them on our webpage and our Facebook page.
And since you visit thegeneanddaveshow.com quite often, it's all right there for you. The links, everything that you heard about during the episode, the phone numbers, which I noticed you corrected what she
Yeah.
said on the phone number. What she said, she was off by 1 digit. So just make sure that you look at the phone number on the screen, or for more clarification, go to www.thegeneanddaveshow.com.
There you go.
There'll be a section for the Marge Petty interview. You know, though, speaking of the interview, shortly after that, we received an email of some people that were not too happy with some of the promises that have been made on the Affordable Care Act, and then having a lot of these cuts come down from Washington, D.C., and, you know, filtering down into our own local and state governments.
Yeah, you know, as a form of social media, a lot of folks will send stuff to the Gene and Dave show, hoping we'll get it out on the air. And when we got that one complaint that you're talking about, it was disappointing to hear, but it's important we get this information out there. We'd like to read some of this complaint regarding the Affordable Care Act, and we're going to read it verbatim because it's important you have exactly what was said.
The organization, here they're referring to ADAPT, is particularly upset because Secretary Sebelius spoke before the National Disability Rights Group in July, highlighting how the Affordable Care Act benefits people with disabilities, including potential to improve access to home and community-based services. While the Secretary gave rousing speeches and was applauded by our community, her staff were crafting guidance to states on cutting our services. This is from Renee Patrick of ADAPT Organizer in Chicago, Illinois.
And we'll have the full text of this on our webpage, so you can look at it yourself and draw your own conclusions.
Yeah, cuts are being made across the board everywhere, and it hurts. But I still hope that the Affordable Care Act will be able to help many, many people out there.
I would say instead of cuts, we should raise taxes for the rich, but then again, the rich fund the re-election campaigns for all the congressmen, so that'll probably never happen.
Well, as she said, you know, the money that's being spent on the Affordable Care Act, they've wrote in matching dollars for it, and ways to make money to make it happen. So really only time will tell. Well, right now it's pretty, we have to be a little bit nervous, but I think all Americans are, because a lot of their favorite organizations and things that they need, their ways of life, are being cut, and we've got to do something.
You're absolutely right, Dave. Thanks so much. And go to geneanddaveshow.com for more information. Thank you, folks.